presence using the link that will be shared in the chat box. It will be shared periodically by the IT, which is Kote and team. So they'll be able to share that link and you'll be able to register your presence for that you have attended this session. So at this point, I'll just ask that for those that don't know, so Dr. Sam Miti has a wealth of knowledge and domain experience when it comes to electronic health records. So this is going to be I expect quite a loaded presentation from Dr. Miti and Mr. Banda. And if you hear them speak about electronic health records, they really speak with passion. It exudes from them. So you'll be able to tell that these know what they're talking about and who best placed to tell us about Smartcare than these two. So at this point, I'll call Dr. Sam Miti to do the presentation. I know that we don't have a case today, so I'll give Dr. Miti and Mr. Banda about maybe 40 minutes to present, and then we can get into a discussion. However, if you have questions during the discussion, you can just write them in the chat box, and some of the experts that are on the call may be able to attend to them. But if you want to be able to speak, just wait for the presentation to end, and then you can raise your hand, and then we'll give you a chance to be able to speak. So as I said, Dr. Sam Miti has a wealth of knowledge, and I know that he can go on and on talking about Smartcare, but we'll limit the time to about 40 minutes so that we get the gist of the presentation, and then we'll be able to interact thereafter. So Dr. Sam Miti, good afternoon.
Good afternoon. How are you? And
fine, thank
good
you.
Afternoon, colleagues.
Yeah, how are you? So Dr. Miti, you can go ahead and take us through the presentation. Then at the time when we have the poll questions, you can allow that we interact with the network so that they are able to vote on the answers. So Dr. Sam Miti, the floor is yours. Thank you.
Thank you very much, everyone. And I hope you've had a good afternoon, a good lunch. My name is Sam Miti. I'm the Senior Clinical Lead for IHM, which is the Institute of Health Measurements. And I'm co-presenting with Mr. Kuani Banda. Mr. Kuani Banda is a health informatics specialist at IHM, and together we constitute the business analysis unit. So by way of sharing the objectives, today we hope to share Smartcare Plus implementation updates, as well as give insights into the new feature developments and timelines. And then we also hope to demonstrate the disability data capture and reporting feature in Smartcare, Smartcare Plus. And for the purposes of this presentation, I know that we usually have the poll questions at the end. I'll ask if we could just share the poll questions. Essentially, there's no right and wrong answer, but they'll help us gauge the priorities for the team. Are we able to share them now?
Okay, I think the IT has shared the question. So the first question is, in your practice, how have you been capturing disability data for ART clients and other patients? This is a single choice. I'll repeat the question. In your practice, how have you been capturing disability data for ART clients and other patients? So can we please poll? We'll give it about 30 seconds for the network to poll. Interesting answers coming through. We've got about 15 more seconds to poll. In your practice, how have you been capturing disability data for ART clients and other patients? This is a single choice. Have you been using MOH paper registers, electronic data capture tools or DHIS, implementing partner-specific tools, or indeed none? Can we get to 50% of the polls? We're at 48%, 49%. All right, we've gotten to 51%. I'll end the poll here, and then we can discuss. So as you can see, Dr. Miti, we've got varied answers. 32% are actually saying none, but 40% are saying electronic data capture, and 20% think that they use MOH paper registers, and the minority use implementing partner-specific tools. So you can go ahead. I think we'll take the second poll question as well, and then we can have a discussion after that. So can we have the second poll question? All right. So the second poll question reads, if one were to think about reducing double entry for health workers, think about reducing double entry for health workers, what two systems, if prioritized for development, do you think can integrate with Smartcare to make your work easier? This is a multiple choice, so you can choose two. If one were to think about reducing double entry for health workers, what two systems, if prioritized for development, do you think can integrate with Smartcare to make your work easier? We've got A, ELMIS, B, DISA, C, DHIS2, or D, NEMA. Interesting answers. So let's get polling, people. We've got about 20 seconds. St. Francis, you can also poll. If one were to think about reducing double entry for health workers, what two systems, if prioritized for development, do you think can integrate with Smartcare to make your work easier? ELMIS, DISA, DHIS2, NEMA. Okay, we've passed the 52%. I'll end the poll here and share the results. So there is 61% ELMIS, 54% DHIS2. I believe some of the people who said ELMIS also said DHIS2. There's 36% DISA, 10% NEMA. Do we have another poll question, Dr. Sam?
No.
Okay, so please take us through. Thank you.
Okay. Thank you very much for these interesting questions, and essentially indicating that about 1/3 of the participants have not been capturing data on disabilities, and that 40% essentially have been using paper registers for the ministry, while as 40% indicate that they have been capturing this data using DHIS2. And then when it comes to what are the priorities, it's very clear that ELMIS, which is the electronic logistic management information system, or the pharmacy logistics system, is a priority. And of course, the integration with the DHIS2 and DISA follow through. Thank you very much for those insights. We'll take them into account. So by way of outline, we'll briefly talk about the introduction, also the policies direction for the Ministry of Health, as well as a Smartcare roadmap for 2023, the major features that are under development and timelines, as well as challenges and lessons learned from rollout and implementation. Then we'll go into the disability features, the demonstration of Smartcare in that regard. I will start by indicating that the Ministry of Health has been very clear about us moving the electronic health record system in one place and moving it forward with Smartcare Plus as the main electronic health record system. And in November last year, is it November or December last year, the Ministry of Health launched the digital health strategy. And this was a pronouncement by the Minister of Health, Madam Masebo, who indicated that her ministry is also officially launching Smartcare Plus, electronic record system, which is a web-based system as a replacement of the legacy Smartcare, which was introduced in 2005. Smartcare Plus has features such as clinical decision support, which will aid in provision of quality end-to-end standardized patient care. And that she expected that all facilities will henceforth begin the processes necessary to completely transition to Plus in the shortest possible time. So just for those that may not be aware or fully appraised, Smartcare Plus is being supported in terms of implementation and development by the SKIS project, which is a CDC-funded COAG under PEPFAR that seeks to do three things. One, by 2026, scale up and optimally performing EHR to more than 1,500 health facilities by the end of 2024. Then build the capacity for the Ministry of Health to improve data automation, data architecture, and meaningful use of quality data for decision-making by the end of 2025. And by the end of 2026, essentially ensure that we have institutionalization and a sustainable way of implementing and maintaining the electronic health record system. And those are the three objectives, strategic objectives that we have as a project. And I just want to speak to the key feature of Smartcare. I know a number of you have seen this, but I think it's very important for us to be able to appreciate what Smartcare is able to do and what it's actually going to do for the healthcare system. The key Smartcare features which makes it distinct from legacy is that legacy is a decentralized system with each facility having its own small database somewhere that does not communicate with other databases except manually through a transport database, which we call TDB, or using the Smartcare card. However, Smartcare Plus is a web-based design where it uses a centralized database. And in our case, we have a hybrid where we have a centralized database, but also we have a local instance that is able to reside in a particular facility, but when there is connectivity, whether it's internet or WAN, then it synchronizes to a central database. But the major features that essentially come with this is the very fact that it resolves a lot of issues around patient movement, data sharing between health facilities, as well as allowing patients to move between facilities, but still maintain a single continuous medical record across the country. And we see that when you use this with other features, such as the biometrics feature that is currently being implemented, although its implementation at one point was halted because of the COVID epidemic, we see that this becomes a very powerful tool that can actually revolutionize how we implement and address or keep our medical records with a single patient identifier. The other thing that I want to speak to is what we call the health information exchange platforms, which is HIE. I know in the HIV circles, HIE means HIV, it's actually HIV exposed infant, HEI, not HIE, okay? So in this particular case, we have developed a health information exchange platform, which is what I'm sharing here in the sense that we have Smartcare Plus with an HIE centralized platform, which then can either be able to use a GWAN or APN network or use the internet to communicate with external systems. And when I say external systems, they can be external to a facility or within a facility, but external to Smartcare. And this is very important because it will help us allow systems that are being utilized by the Ministry of Health for various purposes to be able to speak to one another without the healthcare manually inputting data into the other. And one system that is currently in use is the DISA, which is the Laboratory Information Exchange Information System, okay, but commonly known as DISA, where Smartcare is able to send viral load, EID results, CD4 results, and these can be transmitted through an electronic order, lab order. As you order in Smartcare, the data is transferred to the lab receives it, and once they run the sample and load it from the lab, the result becomes immediately available to the clinician on the other side. And this will reduce lost results and so on and so forth. And another system that is currently, we are actually working actively, and we've been doing piloting, and I think we are almost getting to the finishing line, is the exchange or the communication between the Smartcare Plus, where you do a prescription in Smartcare Plus for your medication, and the prescription is instantly transmitted into ELMIS, or the logistics system that is maintained by pharmacy. And as the pharmacist dispenses in pharmacy, the prescription that they have dispensed in pharmacy automatically is in ELMIS is automatically transmitted to Smartcare Plus, and the clinician is able to see what was dispensed without the pharmacist having to do double entry in two different systems. And this is one of those things that we think has been long standing, but I think we can almost say that we are almost there, and we are just doing pilot testing in facilities within Lusaka, some facilities within Lusaka, to address that. So that is only possible when you have a centralized system like the way Smartcare Plus is, as opposed to the way legacy used to be, where it is decentralized with manual systems in different places. And this is a good thing. Now, by way of giving us a bit of updates, I would like to talk about what is it that we are currently doing. So if you look at this map, you see that Smartcare, essentially as at the end of 2022, was essentially in just about 190 facilities, with 4 in the Northern Province, 4 in Wapula, 2 in Muchinga, 3 in Northwestern Province, 17 in Western Province, but the bulk of them were in Southern Province, 29, Lusaka Province, 56, Eastern Province, 26, and Copper Belt, 36, as the main provinces that where Smartcare had been rolled to. We expect at the end of this year to actually scale up, whereas Northern Province will move from 4 to 15, Muchinga and others will also move from 2 to 7, but the Copper Belt, Central Province, and Lusaka provinces will receive the bulk of these. So where are we scaling up Smartcare? So this is essentially just breaking down to show you the new sites, the new additions that will go by province, okay? So you see that Western Province currently has 17, but we project that we'll add 9 high volume sites and bring the total to 26. Southern Province, we expect to add 23, and bring the, 30, sorry, and bring the total to 53. Lusaka province, we expect to add 15 and bring the total to 58. Whilst Eastern will add 13 provinces, sites that will be added. Northwestern is earmarked for 4. Copper Belt will have an additional 52 sites that would have been added, with the others also being added to different provinces. So what does our roadmap for implementation look like? It's been informed by the TX car, of course, the high volume sites, and we are trying to get as many people as possible onto our facilities, high volume facilities, onto Smartcare Plus, so that you can ease the administration, both in terms of patient management and otherwise. So what else are we planning to do beyond just scaling up, introducing or upgrading or transitioning facilities from legacy to Plus? We actually are working on clinical decision support functionalities and also optimizing data utilization, as well as providing support to both facilities at clinical practice level or end user level, at strategic level, as well as operational level, to optimize the use of Smartcare data for decision making, as well as patient care. And those of us that attended different sessions that have spoken to either the COP, Global Fund planning sessions, or joint meeting that we had, you saw that the data integration essentially spoke to leveraging Smartcare data, or data that can be able to speak and inform these processes that guide decision making. We've also been working around frantically in ensuring that the Smartcare Plus platform and health information exchange is operationalized. We've done that. I know Southern Province has been using DISA Smartcare Plus integration for some time now, but we want this to be used in all other places. And we're also working on broadening the tests that we can be able to access when you're using Smartcare as and you're ordering lab tests. We are big on trying to make sure that we have institutionalization, and this speaks to sustainability. And at various points, we have engaged a digital health advisor. That's what DHA means, okay, who essentially is supporting the Ministry of Health, or is implementing or supporting the Ministry of Health to create sustainability at various points. But we've also been engaging and creating capacity for clinical mentors to support adoption of Smartcare. And I think we've done trainings and orientations in Eastern Province, in Lusaka Province, in Southern Province, in Wapula Province. And we look forward to helping create capacity to support the implementation of Smartcare in the other facilities across the country. With regards to features that speak to Smartcare, or should I say that speak to the end user, we hope to improve the diagnostic accuracy by the implementation of ICD-11, which currently is being utilized. And also we are mapping the standard treatment guidelines that we have for Zambia, both for HIV, but also for clinical care. I know most of us know that the Green Book, the last, I think, edition was 2020. We are essentially trying to translate that standard treatment guideline as an official position that the ministry has given for managing services at primary care level into Smartcare, so that it can help with improving the accuracy, as well as the diagnostic and management accuracy for patients. We also intend to we are working, and I think not this April release, but the subsequent release would have done significant work to operationalize composite pantograph and other features that we have, so that people in labor ward, for example, can be able to use it. And we've done quite a lot. We have a functional pantograph, but we are essentially using this as a clinical decision support tool that is embedded in Smartcare, but we'll only be able to pilot it once the initial work is complete. But we are moving there. And the other is essentially the drug-to-drug interaction. I know that last year we implemented the dosing by weight chart, by weight bands, which has in a way improved the ease with which health workers utilize Smartcare or use Smartcare for prescription, which is a good thing. But we are going further to use to implement clinical decision support that can improve how you prescribe, how you monitor drug-to-drug interactions. And I think also, like I've indicated, we have increased significantly our capacity for our server capacity to help the exponential growth in healthy data that is being managed under our portfolio, and improve the efficiency of utilizing the upward sync and the downward sync for global SAGE. I think I've already alluded to the fact that we are working and will continue to work with our partners, which is JSI, as well as APHL for the lab information system, or DISA, that I think we are currently implementing, but we are continuously improving. Other features, really, this in the next couple of weeks, but indeed in this month, we are most likely to go ahead with the ELMIS Smartcare Plus integration, okay? And also we've updated the laboratory request form to reflect the standard, the laboratory standards that speak to a lab requisition form. And we've also fixed the barcode issues that were initially raised or brought to our attention. It is also important to make mention that we've had delayed implementation in the Defense Forces of Zambia facilities, excuse me, because of the Defense Forces specific requirements that Smartcare needed to have, and we've developed those requirements, and now we are essentially doing internal usability testing, which I think so far is good, but we'll be having external usability testing soon. So these are features that speak to different things that we hope to have, and we hope to have, but by the end of the year, we hope to bring on board the cervical cancer module, as well as the surgical modules that I've indicated earlier. However, this journey has not been without lessons as well as challenges. And part of the challenges that we've seen is that the scale up that we've been talking about needs quite a lot of resourcing, both financial resources, infrastructure, training and capacity building, and others. And we need to have all service areas implementing. Smartcare Plus or Smartcare has been well developed in the HIV care services, but for it as an electronic health record system, we need it to tick in all service areas, whether it's MCH, whether it's inpatient, whether it's surgery, and so on. And that is key for us. And so we've been engaging various partners as well as different areas. I believe Mr. Innocent may speak to that if opportunity allows, how that we should not just view Smartcare implementation and scale up as scale up only in HIV care services. We need to scale up in the health facility wherever service provision is being implemented. Sometimes we've seen that it's been a challenge when you have an inadequate integration of services, as well as inadequate utilization of the HIE platform, like the way we have indicated that Smartcare is already integrated with DISA, but we don't have optimal or optimized uptake in certain areas of this. We need to further interrogate why isn't this so, or why isn't not happening that way. It is important to have implementation partner buy-in, and I think this is key to the success of implementation for Smartcare in terms of rollout, but also in terms of scale up to all service areas. And like we always say, there is no success for a clinical program without the end user, without the clinical end users at the center of it. And we think that one of the big lessons we've learned in this implementation is that we need to have health workers, clinical workers as end users drive the process of adoption, if we have to have sustainable adoption for this. And I think lastly, but not the least, we think that we need to celebrate the digital health heroes that make progress possible in different facilities. And I think we have seen that there are facilities that have done extremely very well. Mungu Baptist, for example, is one of those that, not Mwembeshi Rural Health Center has done extremely well implementing Smartcare Plus in almost all service areas as a facility. And these are some of the heroes that I think we need to champion and see how they are implementing for us to learn lessons from them, but also to celebrate them, as well as at the local facility level, we need to recognize the Smartcare Plus champions that are helping with the social learning that comes with Smartcare. So I would suggest that probably we go into the disability feature demonstration, or would you like us to break briefly, take a bit of questions, and then proceed into the disability? You can guide, chairs.
Okay, thank you so much, Dr. Miti. You forgot to mention that Kamwala Urban Health Center is also a champion in Smartcare usage.
Oh,
yeah.
Yes.
Yeah. So I'm really enjoying the discussion so far. So I can see a comment from Setswayo. I commend the team for the great improvements so far made in Smartcare. I'm sure this is a Smartcare Plus user who has seen how Smartcare has evolved, you know, starting from legacy, going into the Plus, some of the challenges that we've had, which have already been resolved, which is a great thing. I'll suggest that if we have some comments, we can take a few minutes, just maybe 5 maximum, so that we can just interact for the session that Dr. Miti has done. Do we have any questions? If you have a question, just raise your hand. If you have a comment, just raise your hand, and we'll be able to take on those before we go into the demonstration. You know, having been at one of the pilot sites for the ELMIS, I can say that it will really be a game changer once everything is operationalized very well. Yeah, so we can go with Dr. Makelele first, and then Dr. Onoya. I can see your hands raised.
Okay, thank you, Chair. First of all, I'd like to congratulate the team for the job well done. For sure, this is the game changer for our way of delivering, especially us who are in HIV. We have seen the value of this platform. Now, I'd like to find out, apart the human capability, what make the TX card drop when you install Smartcare in a facility, when you change from legacy to Smartcare Plus? Is there anything on the system which make it always the first number drop I thought it's a human part to justify that. But is there any system on technical part which can justify that? Because that has been one of the common issues which come when they install Smartcare Plus for the first time in a site. Over.
Thank you so much, Dr. Makelele. I'll suggest we take 3 questions first, and then Dr. Miti can respond to them. Dr. Onoya.
Yes, so good afternoon. Good afternoon, Dr. Miti.
Good afternoon.
Yeah, thank you so much. First of all, we would like to appreciate all these innovations under Smartcare Plus. And we believe that they are going to improve the clinical decision-making process in the facilities. But I've got 2 concerns. The first one is about the management, or maybe the monitoring of retention, because we know that retention is one of the key key indicators we are tracking. As of now, tracking retention has been quite difficult. The appointment list is not accurate at all, and a number of tickets have been raised to see how best this issue can be addressed. So far, nothing has been done, and we are still relying on the use of appointment registers in the facilities. So is there something that can be done to ensure that we have accurate appointment list in the facilities? Because without an accurate appointment list, even these other indicators like viral load coverage and so on, they are also suffering, since we can't know who is due for appointment and who is not due. The second concern is about the rollout of Smartcare Plus. So, of course, you've talked about the plan in place, and I want to know if this only concern the public hospitals, or maybe there's a plan to roll out Smartcare Plus to private facilities as well, because I know some of the private facilities have got their own system they are using. Since we are trying to integrate Smartcare and ELMIS or DISA, so is there any plan maybe to ensure the rollout of Smartcare to private facilities, or maybe to have that connection between the system they are using and Smartcare Plus? I submit. Thank you.
Thank you so much, Dr. Onoya. And then we'll take one last comment from Kaomavupe, and then we'll allow the presenter to respond. Although I'd like even some of the experts on the call, if there's a question that they'd like to address directly, they can also come in. So Kaomavupe, your comment, and then we'll go to Webster, Chewe, and Matthias. So Kaomavupe, we allow the presenter to respond, and then we'll go to the other hands as well. So Kaomavupe, you can unmute and give your thoughts.
Thank you very much. So my concern is quite similar to what was asked by the first doctor who made the comment, but mine it's in line with TPT. So we have noticed that when you run the reports in Smartcare Plus, it's able to bring out clients who are eligible for TPT after taking TPT for more than 3 years, those who are eligible again to get TPT, and those who have never taken TPT. But then from the patients being flagged to be due for TPT, we have identified that other clients have actually been reinitiated on TPT, and yet Smartcare Plus is still picking them to say that they are due for TPT. And then the other thing is that other clients have been on TB treatment, and yet the same report is still flagging them to say that they are due for TPT. And this has been reported. I don't know if there's anything being done on it, or in the new patch, if it has been corrected. Thank you.
All right, thank you so much. So, Dr. Sam Miti, you've got a panel of experts. So if you feel like maybe there's another expert that can attend to a certain question, feel free to just call upon them. However, you can go ahead and address those three concerns quickly so that we can take a few more hands.
Okay, thank you very much, Dr. Makerere. Welcome. It's great to see you on this platform, and thank you for your question. So actually what you've said is quite very true. A number of times when we have done a transition from legacy to plus, sometimes you see that then the TX car tends to drop, okay? But the truth of the matter is that Smartcare Plus has much more stricter logic, and in many cases, it would demand that we do certain things to make sure that only the valid patients, even the ones that may come, but their data are not completely in place, it may want that for accurate data, for accurate and quality data, we need to have complete records. So that is one way that we've always seen Smartcare figures drop in terms of having TX card drop. But that's something that we've also worked on, in the sense that we can be able to tell you, to say, when you run this is probably how much we may anticipate the numbers to drop, and that is usually contained in the release notes that we usually give with regards with that accompany a particular release. And we usually try it out with a number of TDBs before we actually release. And so in a way, it's a good thing, in the sense that I know that we always want numbers to be as reflective. And I think those numbers should also be, we want to have the correct position. Yeah, we've had this discussion several times with Prof. Mlenga, where we discuss and say, where is our true TX car? And it's usually a very interesting discussion, I should say, but thank you for that. I want to also indicate the other question that Dr. Makerere brought forth in terms of monitoring of retention. So that's the key thing that we need to have. We need to be able to track both the ones that we need to have mechanisms that inform us about the ones that are being returned, lost to follow, and ensuring that we have the ones that need active intervention are receiving that intervention. We are working on an artificial intelligence model, which currently we are working with Palantir and others, and Cooper Smith, who are essentially partners in this implementation. And one of the things that we are doing is trying to work out a model that can help predict loss to follow and help improve retention. And that is something that we have agreed together with the program, of course, that we need to find ways of returning. However, one of the key things, which I think the current ART register that we have implemented in Smartcare has been able to do, is that it is a mini data set that if you triangulate, you can actually be able to effectively use it to even inform the ones that are due for ART, as well as the ones that can be that are lost to follow. But in short, what I'm just trying to say, Doc, is that we've added certain features in the ART register that can actually help. And I'm hoping that the conveners of this platform can give us another opportunity where we can be able to demonstrate the optimal use of the revised ART register that we did about 6 months ago, so that it helps address some of the issues with regard to patient retention, loss to follow, and tracking of patients. So those were from Dr. Makerere. I'll also request Dr. Makerere, if opportunity allows, we can have a session where we can also help your team on how to optimize this function, because I feel that it has brought a lot of, it is one of those painful moments and points where this can be part of the solution. Then Dr. Onoya, the rollout of Smartcare, does it include the private sector? I'll leave that probably to the Ministry of Health as the governing authority around what health systems to use for different health services, which encompasses the private sector. But the little that I know is that we have disease surveillance that goes beyond health facilities, whether it's a public or private sector. But for Smartcare, by and large, more Smartcare in health facilities, public health facilities, or faith-based facilities, or in the context of certain big private sector facilities like the mine hospitals, they've been able to leverage our the public health electronic health record system, in this case, Smartcare Plus. Then around the TPT, I'm glad that you've acknowledged that actually the TPT, the Smartcare registers, even the ART register, has these features that are able to show who is eligible for TPT, as well as when somebody is due. I'll ask probably my colleague Kwani to say something probably around there. I'm not very sure about whether an issue, an incident has been raised in the help desk around TB patients being reinitiated on TPT prophylaxis. But if that is the case, I think we'll actively follow it up and see how we can tighten the logic. But I'm not fully aware around that. I'll go back and check, or if KB Kwani, my colleague, has information around that, I think he can be able to chip in. Thank you.
Thank you so much, Dr. Miti. And I know that KB will probably speak to also try to refine Dr. Onoya's concern about the retention and how it's being affected, and how we are not getting these accurate lists. So I know KB will speak to that. So before your presentation, KB, I'll ask that maybe you can attend to Dr. Onoya's concern and Wupe's concern about TPT as well. Allow me to take 3 more hands, and then very quickly just go through this, and then we go into the demonstration. After the demonstration, I think we can come back to the questions. But I can see Dr. Shampile's hand is raised, so allow me to jump and ask that Dr. Shampile can unmute and give his comment. Dr. Shampile, welcome.
Thank you very much, Dr. Malilwe. I just wanted to give a comment on the issue that was raised around Smartcare in private hospitals. Our plan as a ministry, first of all, we are looking at the public sector to ensure that we've got a functional electronic health record management system. And in this case, we're talking about Smartcare Plus, which we're rolling out. In private hospitals, it's not an absolute requirement for them to be on Smartcare Plus. But if we had to receive a request from a private hospital requesting for deployment of Smartcare Plus into their facility, I don't think that would be a very big challenge for us. But our priority right now is for the public sector, the faith-based, the military. So those are the ones that we are really targeting. And as we go along, as we, have more lessons learned and refining the system itself, we may, at some point, maybe try and, bring the private sector, because at the end of the day, healthcare, whether someone consults from a public institution or from a private institution, we need those statistics. So private hospitals do report into the DHIS too, and we need those statistics. So if these electronic records are availed both from the public and private sector, we're going to have more reliable data, that is electronic data. And I think that is the vision that we have. But as at now, private hospitals is not really a requirement. Even in our rollout plans, we do not include private hospitals as we are rolling out Smartcare. But if we had to receive a request, definitely, maybe that could be considered. But right now, it's not a priority. Thank you.
Thank you so much, Dr. Shampile. For those that don't know, Dr. Shampile is the e-health director or digital health director at the Ministry of Health. Thank you so much for coming through and clarifying that one. Dr. Shem Kabesha, you'd like to give a comment?
Yes, thank you so much. I just wanted to add on the accreditation in the private sector. If we take you back to memory lane.
It's very faint.
Dr. Kabesha, your line is quite faint. We can't get you clearly.
Can you get me now?
Yes, please.
Am I audible now? Okay. So I just wanted to go back to history over the private sector. At one point, through the Professional Council of Zambia, Health Professional Council of Zambia, for them to be accredited, one of the requirements was Smartcare. And I remember those days we used to train them, and then they were supposed to put their funds in the system. And then one of the checklists was to make sure that they provide the service using Smartcare. So I think it's just like Dr. Shampile said, it's just to strengthen it again, to make sure that that system is being used. Of course, they have other systems. And the issue is that as we are now with Smartcare Plus, it has now some functionalities that were not there in legacy, which now is, I think, making it possible for them to use it. So from the accreditation side, it was a mandatory thing for them to provide the service. So after they have maybe done that, they will now just use it for the sake of accreditation. So we need to go back to the laws and see how we can enhance that so that they continue using it. I think from 2009 and forward, that was one of the things that was done. And there was also even an IP that was strengthening the private side for deployment of Smartcare. So if you look at in the database, you find that most of the private facilities are in our database because they were mandated to be part of that for deployment. So we just need to come back and look at that. Just maybe to look at the service, looking at Smartcare and reporting. So maybe that just a few sentences there. We should distinguish between the reporting and providing a service. Normally what happens is when we see a report is wrong, we think the system is wrong. So what we need to make sure is to make sure that we continue entering the information as the developers are looking at the report, because the report is just tapping from the bigger well what you need. So those are the issues that we should distinguish between looking at the system as it's not functioning well, but it's just the report. So if the service is provided, it means it's working, but the critical part is to make sure that the reporting side, the queries are done accurately, and also depending on the dynamics that come in, the reports may change, as Dr. Miti has said. But Smartcare Plus now is looking at business process. If you have not entered the HTS, you don't expect that client with a positive result to be counted on the Smart TX car. There should be an HTS interaction with a positive result. So such things should be looked into. While the legacy was just when you tick the IAP, it was like this person is enrolled in Smartcare and then they'll continue. So when you now roll to Smartcare Plus, it now looks for those other logics. Then it will drop them, and then we need to do some backlogs for those. Over to you. Thank you.
Thank you so much, Dr. Shem. And thank you, Kakwasha, for attending to some of the questions in the chat box. I'll just remind that some of our experts can also just take a look at the chat box, answer some of the questions that are there. Just noting that Dr. Duncan Chanda is saying that we needed, you know, the EHR like yesterday, so it's great to have it. Dr. Singini is saying it's exciting to hear that the ICD-11 would be included. So now what we're going to do is we'll allow the 4 hands that are raised to raise their questions, but the answers will only be given after KB does his demonstration. So Webster, Prosper, Mwangala, and Ilunga, you have a minute each to just ask your question. We'll answer those questions after KB's demonstration. I know that KB's demonstration shouldn't take longer than 10 minutes. So let the people ask the questions, then we'll hold on to the answers. Webster, you can go ahead and unmute and ask your question. Please keep it short.
Okay, thank you very much, moderator. I just want the panel to comment on the power backup, especially for those sites that are e-first, because we usually face a lot of challenges to locate the patients when you have a power backup. And I've seen that in all the sites, especially on the Copper Belt where we have this, they don't have the power backup. I submit.
Thank you so much, Dr. Chewe. You've kept it very short. Prosper. Prosper Lunda.
Good afternoon, team. Good afternoon, Chair.
Good afternoon.
I just wanted to find out what really transpired when starting Smartcare Plus. I've used Smartcare Legacy for some time, and it has been working quite well. Despite the few limitations that we have, like a centralized server. So now when you look at Smartcare Plus, it's more like a whole different system that we have, or a whole different app that we have. Was it possible, or is it possible just to put in the engines that we have from Smartcare Plus into Legacy to facilitate bypass the few limitations that we have, like centralized saving or a centralized server? I submit. I don't know if I'm clear.
Thank you so much, Prosper. Your question is very clear, and given more time, I know Dr. Miti talks about this in detail, why Smartcare Legacy, we really need to let go of it as we move to Smartcare Plus. Part of it is obviously the internet connection, and just looking at Smartcare Legacy, you can tell that it's an old system. It doesn't give the design vibe, if you know what I mean. But with the Smartcare Plus, you know, you have a user interface that you can really enjoy working. However, I'll allow that Dr. Miti will address that after KB's presentation. Mwangala. Mwangala Situtu, you can unmute and ask your question or give a comment.
Good afternoon, Chair. Good afternoon, everyone.
Good afternoon.
Thank you for Smartcare Plus, but Other than the appointments challenge which we've found, we've also found a challenge on viral load. It pushes the viral load appointment 6 months later. So at the beginning, we missed a lot of clients who are due for viral load, because when you check in the system for Smartcare Plus, it shows them 6 months ahead. But when we go in our physical registers or in the lab, we find that that person is due that same period. So we don't know what is happening, because it's making us lose patients. They come from faraway places, and sometimes we only realize later after they've gone that they were actually due that same day which they came. Thank you.
Thank you so much, Wangala. Then the last hand will be from Ilunga, Dr. Chamba. Ilunga, you are quite faint. I can barely get you.
Am I better now? Hello?
Yes, much better.
So my question is on confidentiality and privacy. Is there any feature, or what can we do to ensure that confidentiality and privacy of our clients are maintained at all points in Smartcare?
Thank you so much. So at this point, as I said, we'll allow KB to do his presentation. KB, I'll deliberately give you 15 minutes so that the other 5 minutes you can probably answer some of these questions that have been raised, because I know you are well placed to respond to some of them. Please keep the responses quite short, but please go ahead with your demonstration. We should be able to take more questions after 3:50 in the last 10 minutes, and some of the comments from the other experts. KB.
Dr. Muhuma, and good afternoon to everybody. I hope I am audible. Can you confirm?
Yes, you are, and I think I can see your screen as well. So please take us through.
Thank you very much. My name is Kuwani Banda. I am the clinical informatics specialist at IHM, and I work with Dr. Miti, and our job basically is to ensure that all the content in the system adheres to the clinical standards and clinical standard operating procedures. My job this afternoon is to take you through the new feature which has been added into Smartcare Plus and Smartcare Legacy, and that is the disabilities functionality in both Smartcare Plus and Legacy. So I'll quickly go through Smartcare Plus. Mind you that I have taken the liberty to go through the entire way of enrolling a client on treatment. That means I've done the HIV test, because that's a prerequisite in Smartcare Plus. And maybe I even answers one question that was answered about why TX card drops in one system when it's migrated to another system. It's because one system is clinically stronger than the other, and we are adhering to the actual practice as opposed to just having a client start on ART without a positive test. So I'll look for a client, I'll search, and mind you, I have already registered the client, and I've already made them reactive, and I'll just show that. So that it will be all after registration of the client, and they took the test. That was determined and BioLine. And of course, the diagnosis was positive, HIV type, and the results were given to the client. Okay, so when it comes to disabilities, you will find disabilities in two interactions in Smartcare. That is the iHappy. It's no longer iHap, which is the initial history, physical, and initiation, and the clinical follow-up. You find them in two interactions. So I'll start with the ART physical, initial history, physical, and initiation. That's where the disabilities function is found. Of course, I could have gone with the patient locator, but it's like asking what came first, the egg or the chicken, which I won't do today. Okay, of course, in normal clinical flow, we'll undertake the vitals. The HIV tests is already filled out because this is linked to the HTS. So this is already filled out. Of course, you would undertake all these procedures. But today, as I said, I just want to highlight the disability function and how it actually functions in the system. So you have the card called disability. This is the new card that has been put into Smartcare Plus. The client have disabilities. I'll open it. Does the client have any disability? You say yes. Of course, on default, it's already on no. If the client does have a disability or disabilities, because it could be more than one, would click on yes. Just give me a minute. Answer this. We'll click on yes, and then it will show which you can click on which disabilities the client actually has. Of course, I'm picking all of them, but I just want to show you that this is how you can actually pick on these predefined disabilities. And of course, if the disability is not on the list here, there's another disability which is not on the predefined list. You can also go into other disabilities, which will open up a free text, and you can type in the disability. And once this is done, you would apply, and then this information is saved. This information is actually saved. So when you go into the next clinical follow-up, you already find the information. That means if a client, just say, is deaf, you won't have to enter each time that they're deaf, that you have to go to disabilities and click on deaf. No, it will pick up from the previous interactions. So if they're miraculously cured or they've undergone treatment and they're no longer deaf, you can remove it and it will continue from there. So that is a disability function. This is available in the adult, initial history and physical, and the clinical follow-up. This is also available for pediatric as well. We haven't left the pediatrics out. Just give me a minute. Let me just we have a pediatric client here as well. If I enter the pediatric iHappy, you will find that the same functionality is available for the pediatric as well. Same as for the adult as well. You have it in pediatric iHappy, and you also have it in clinical follow-up. In adults, you will not find it in stable on care. I repeat, you will not find it in the stable on care form. And just a quick one, that is Smartcare Plus, but just to know that we are really focused on Smartcare Plus, I just wanted to show that we also look at our legacy folk who are still on legacy, who have not transitioned yet to Smartcare Plus. So we also have done the same disability test, the same function in legacy as well, so that they don't feel left out, because this is being rolled out nationally. So the same rules and same procedure as Smartcare Plus. You will find it in the iHapp and in the clinical follow-up for both adult and pediatric. As you can see here, it's exactly the same. Is a client disabled, then you click you choose which disability the client is experiencing. And this, of course, will be same as legacy as Plus as well. This will be carried on to the next interactions, the subsequent interactions. That means each time you open a clinical follow-up, you won't have to go to disabilities. If they're deaf, it will already show that they're deaf, and it will continue from there. I can just give an example of this. I can save this edit. And then if I open, give me a minute. Give me a minute. If I open a clinical follow-up, you will find that disabilities is there, and these are the ones I picked in the iHappy, and you find that they have continued on to next interaction. I was unable to do this with Smartcare Plus because Smartcare Plus is stricter when it comes to the clinical aspect. There's certain things I have to fill out before I go into the next, if I could save, and that would have taken some time. But rest assured that this functionality is implemented the same in both legacy and Plus. This is where I'll end my presentation. Thank you very much. I will leave it for questions.
Well, thank you, KB, for your presentation. And I think it's quite clear. I can see there are some questions in the chat box, but before you handle those, are you able to just talk about number one, Wupe's question about TPT and TB treatment? Then also just highlight something, I think, on Dr. Onoya's concern about appointment lists that are not accurate. I know you will talk about how you can get more accurate data and like just going directly to the appointment list. So can you talk about those two things first?
Thank you very much, Doctor. And I'll start with the appointment lists. It has been noted that the appointment lists, of course, with when it comes to software development, you always have some issues in certain either reporting or in clinical functionality, and the reporting list have been noted that there's some bugs in them and which we need to work on as IHM. But if you look at as Dr. Miti said, if you look at the ART register, that data set, I wouldn't even call it a report, is aimed at being an all-in-one encompassing data set. In that you can actually, the thinking behind that was, in legacy, you have had too many reports. You have a report for every single function and hence you have over 160 reports, siloed reports, which more or less contain the same information. If you look at the information that is in the late for pharmacy pickup, it's the same information you will find in due for viral load. I'm just giving an example. So the thinking around the ART register was that let's have a data set of all the data sets, of all the columns that users actually need when it comes to the HIV cascade. And that's where the ART register thinking behind came, and it's continuously being improved. And now to answer the question directly, you can actually get an appointment list actually from the ART register, a more accurate appointment list from the ART register, as opposed to having siloed reports. You can actually get a due for viral load actually from the ART register, because remember the ART register has the column for clients on when their last viral load, the date of the last viral load, and when the next one is due. So that's already due for viral load. The ART register as well additionally has date of pharmacy dispensation and next pharmacy dispensation. Already right then and there is an appointment list. All we need to do is to manipulate, just filter here and filter there. And I'm sure that most facilities do have M&E staff. And besides the M&E staff, the clinical staff as well. It's not really hard. The clinical staff as well can actually learn this as well. I would urge them to reach out to us and on how, and I think Dr. Miti was right that we need to maybe to have a session on this, just to show what we really talk about and when it comes to the ART register. I'll go to the second questions on TPT. As Dr. Miti said, we'll refine that logic and we'll look at the incident. Of course, we'll do our investigations. There is a standard procedure that when it comes to incident management and resolution that we will actually undertake, and that is something that we'll definitely work on. and we'll inform the House when that is done. And because we are yet to receive that as the clinical unit. Of course, IHM has multiple units, and the unit that's responsible for reporting is the Health Informatics Unit, but we work together to ensure that these incident management and these incidences are actually closed out. So we have taken note of the TPT being updated. It's a logic issue, and we'll look at that and look at its optimum resolution. I don't know if there's any other question, Dr. Wama, which have left out on the first set.
Actually, yeah, I think you've ably answered those two. I know that there are follow-ups to your answer in the comment section. So you do well to just have a look at the comment section and probably also just respond to Dr. Onoya again and Jacob Mutale from CIDAS, who are asking about the ART register, the QIQA report, and things like that. I can see there's a lot of interaction going on in the chat box. So we have a hand from Matthias, who are allowed to unmute and speak, but I also want Gerard Mungwa, who's one of our M&E in the M&E team at the province, who will also come through to just talk about his experience of disappearance of TXK. So Matthias will go first, Osman second, and then Gerard Mungwa. I hope you are able to also unmute. Matthias, go ahead and unmute and then ask your question. Then remember, we still have 3 pending comments. So after these 6 comments, we'll allow the 2 presenters and the panel of experts to just respond to the queries. Matthias. Matthias Simwinga. Are people able to unmute? Matthias Simwinga. Osman, you can unmute and ask your question.
Hello.
Yes.
Good afternoon.
Matthias.
Okay. Yeah, this is Matthias. Thank you so much. I was not unmuted. I appreciate the presenter for the well presentation that have been done today, and also everyone on the call for the questions that they're asking. They're really giving us a very good insight. My concern is with the TB module. The TB module really, it needs to be given the necessary attention it requires, as much as I know that all the other modules are as important. But with the TB module, it's worse in that at the moment, we are only able to interact with Smartcare Plus when it comes to clients who are backed confirmed. Otherwise, all clinical and all the other confirmed TB cases are not able to save in Smartcare Plus. And so we don't know how quick and how early you would say these would be attended to, because all TB corner or chest clinics are now having backlogs. Remember that immediately this fix is done, they'll need to go back to enter literally everything, and work is piling for them. Thank you so much.
Thank you so much, Matthias, and I completely agree with you. And I think this is an issue we raised with KB and team about how the TB module can be enhanced and so that we can be able to see clients better. So thank you for that. Osman, you lowered your hand. You don't have a question anymore. Gerard Mungwa, are you able to unmute and just give your comment and experience around the text card drop? I can see Dr. Mwamba Simutowe has joined the chat box and giving some valuable advice. Osman, go ahead and unmute. Yes, Osman, please go ahead. I think your network, I can't hear you. Your network sounds to be, maybe it's my end. Can everybody hear Osman?
No, we can't hear you. His network is bad.
Yeah, Osman, your network is not really good, so we can't hear you clearly. Are you able to either move to a place with better network or type your comment in the chat box? At this point, I'll allow Dr. Miti and team to just talk around some of the concerns that have been raised. Dr. Webster Chewe raised the concern, and the other speakers as well, Ilunga and Situtu raised some comments. So Dr. Shampile, you can go first.
Thank you very much. I think I'll get this question around power backup and what policies we have and the challenges that the users are having because of lack of power backup. When we deploy all these electronic platforms in the facilities, I think it has to come with power backup. And in the digital health technical working group, we have a standards subcommittee. And I think this is one of the key components that we can look at to be one of the priorities. We really need to have power backup as we are deploying all these electronic platforms, because if we don't, it's going to bring a lot of frustration to the users, and it will compromise on the change management. And already we are seeing users that are saying Smartcare Plus is not as good as legacy, simply because we are still navigating those change management issues. So when you are transitioning from one system to the next, usually there'll always be, pointers that will show that maybe the current system or the system that you are deploying may not be as good as the previous one, simply because people are comfortable with the feel of the existing system. And if it is a bit different from the one that is being deployed, issues of resistance might come in. But what is critical is that as a ministry, we have to navigate and we have to be alive to all these frustrations that can seemingly creep into our into the users. So that issue of power backup, it's very true. We really need power backup to ensure continuity of service, even when we do not have power from the grid. I submit.
Thank you so much, Dr. Shampile. Because we have just very few minutes remaining, I'll allow the experts in the order I'll call out to just give comments and possibly answer some questions as they give their final thoughts. Mr. Innocent Chiboma. Is Mr. Chiboma still on the call with us? Okay.
Hello?
Kakwasha. Yes, Mr. Chiboma.
Yes, good afternoon, everyone. So, is there something particularly you'd like me to comment on?
Not necessarily. Yeah,
okay.
We just wanted to get some final thoughts from you as one of our content experts. just around Smartcare, the deployment of Smartcare nationwide, or indeed any other comment that you'd like to make.
Can you hear me? Hello, can you hear me?
Yes, clearly.
Yes. So we're trying to see how we can be able to have a more holistic strategy at health facilities, so that we can have a bit more investment into alternative power to allow for continuity in terms of service provision. So apart from just implementing partners and everyone around the table, we're trying to engage even more players in this area, so that we can be able to take advantage of what they can be able to offer us in terms of alternative power, solar and things like that. So maybe that's one thing. The second thing, I think the issue to do with private facilities, I think as Dr. Kabesha mentioned, in the past, there was some funding through Global Fund, I think, to the Zanin, I believe. They were offering that kind of support to private facilities who wanted to deploy Smartcare. But as you understand, it's funding towards the public sector. So for private facilities who have the equipment and everything, I don't think it's an issue. And I think as Dr. Shampile mentioned, I don't think it's an issue that we can bring them on board, and I think the software will be free to them. It's the equipment that's what really would be a problem. If they have the equipment, not a problem. Thank you. That's my comment.
Thank you so much, Mr. Chiboma. We can have some final thoughts from Dr. Mudenda Mphatso.
Good afternoon, everyone, and thank you very much for the presentations and all those questions that have come through for clarification. And we all know that Smartcare Plus is a work in progress, but with this kind of feedback that we have received today, and also all the other feedback that we have been getting from different stakeholders, it's helping us to continue improving this system so that it can meet the needs of all the users. I think with Smartcare Plus, where we are now, what is important is to make sure that we do have the infrastructure that is required to make the system work. Like one of the panel members have already contributed. And also that we should make sure that there is that plan for change management, which is very key, because we are transitioning from one system, which is legacy system, to this Smartcare Plus. So it is good really that we have everyone on board, starting from the national level, going down to facility level. And I think another key thing also at a facility level is training to make sure that all the users are familiar with the system and they are able to use it. They are able to enter the data as they are providing the services, but also at the end of the day, they are getting the reports that they need to use for patient management, data management, and also for reporting. So I just want to say thank you very much to everyone else for the contribution and also for the variable feedback. Thank you.
Thank you so much, Dr. Mudenda, for your thoughts, final thoughts around today's session. So I'll allow two last speakers, that would be KB and Dr. Miti, to just give their final thoughts, starting with KB, who will attempt to very quickly answer some questions around TB, cervical cancer, and things like that, and just give your final thoughts today. KB.
Thank you, Doc. And just to answer a few of the questions that were asked, and especially on TB, yes, it has been noted that only gene expert is functioning, but I'm very glad to inform you that in the upcoming upgrader, that will allow all the TB diagnostic tests to have access to the dots. That includes LAM, microscopy, all the and clinical as well, using chest X-ray. So that has been fixed and upcoming into the upcoming upgrader. Cervical cancer, that is a feature that you will see during the course of this FY. They will have a full cervical cancer screening module built into the system. And the last one, I just wanted to attempt to look at what Philip from Titus was talking about adding the food and tab and contact allergies. Yes, that's something we're also working on. And the third question about the ART locator being part of registration. That was a very interesting point, because if you look at Smartcare Plus now, those of you who have used the system will really know that the patient locator is literally registration. You have to edit registration to have any information in patient locator. They're intertwined, because that's the thinking. As I said, Smartcare Plus is a bit stronger clinically, and that's what we've done. And in the upcoming upgrader, you will find that even binding, even for those household contacts, you have to bind them using the binding feature in registration. So basically, the locator is literally the registration module. So if you do everything registration properly, you find that your locator is already filled out. And for my last talking points, I just want to say thank you everybody for attending this meeting. And of course, we are continuously trying to improve the system. We hear your feedback, we get the help desk incidences, and we are continually working on resolving those and making sure that Smartcare Plus is a system that you can use for patient management and, of course, data management. Thank you very much. Over to you, Dr. Miti.
Thank you so much, KB, for your final thoughts. Dr. Miti has been generous enough to share his number in the chat box. So I know that there are a lot of issues that we can talk about and try to get clarity on. And he's very happy for you to get in touch with him. So you can just quickly look through the chat box and probably give him a call. I see Kasongo, you've seen the message. So thank you so much. I'll allow Dr. Miti to just give his final thoughts for today. Dr. Miti.
Thank you very much, Songo and everyone. I'm grateful to everyone. In closing, really, I just want to say that Smartcare Plus is the way to go. It's still work in progress with quite a number of shortcomings, but the platform is the platform that can take us into the future and can add a lot of clinical value. HIE, Health Information Exchange, platforms are things that are meant to help health workers improve and not be punished for being health workers in terms of utilizing multiple systems. So that's something that we should all embrace, and that we should embrace Smartcare implementation beyond ART for it to have meaningful use and adoption as this electronic health record system. And of course, I think we've incorporated the disability and physically abled people around in everything that we do. With that, I want to say thank you very much. And we look forward to another session where we can demonstrate the ART register. Thank you.
Thank you so much, Dr. Miti. Thank you so much, Kuanibanda, and the other experts that were able to join us for this session. I thoroughly enjoyed this session, and learning has taken place. I can see that there were so many comments and people really wanted to go on and on. However, we can't go on and on because we've actually overshot on time by about 8 minutes. But just want to thank everybody that was able to join the call. That was very, it was very interactive. Kuwani Banda has also shared his email and his number in the chat box. So before the call is ended, please take note of the contact so that you can be able to take this further. At this point, I will just ask Etambuyu if there are any last announcements that you'd like to make, and you can close the meeting for us. From me, my name is Muhuma. It has been a pleasure. Thank you so much.
Thank you very much, Dr. Muma. Thank you very much, everyone, the experts, the presenters, and the response, the overwhelming response from the network. This was a wonderful session. So look forward to another session, not next week, but the other week. Next week will be a public holiday. We'll be celebrating Easter Monday. So we should have something on PMTCT on the 17th of April. We'll share the details in due course. Otherwise, thank you very much, everyone. Bye.
Bye-bye.
Bye-bye.
Bye-bye. Bye. Thank you.
Bye.
Bye-bye.
Bye.
Bye.
Bye-bye.
Bye.
Bye-bye.